Welcome back. Compression socks are a good idea for people with diabetes. They can help with nerve sensitivity and swelling. They can also improve circulation. So how do you get fitted with footwear that is healthy and comfortable? Samantha Krumree and Kate Griger are with Xceed Medical. Hi, ladies.
Hello, good morning.
Good morning to both of you. It's great to see you. I'm going to start with you, Samantha. Can you tell us about the services that you provide at Xceed?
Yes, so we provide patients with diabetic footwear inserts, compression stockings, off the shelf and custom bracing, breast pumps, and also do the fittings. So any custom fittings that you might need as well.
That's a lot of different services, but I'm sure each one is sort of customized to a person's needs, which I think is fantastic. I also want to ask you just about the importance of footwear for people who have diabetes. Why is it so important for them to take really good care of their feet?
It's really good to take care of your feet because there's so many high, risks that come with it, like amputation, foot ulcers. So it's really great to get fit with the proper pair of shoes that you would need. Here in the US, especially about 67% of people end up with foot amputations just from diabetes alone. And then 80% of them are preceded by amputations due to ulcers.
Yeah, that's tough. We talked about compression socks and the benefits, some of them being reducing swelling as well as improving circulation. Talk about that a little bit, Kate, and the benefits really to wearing compression stockings and maybe just how you define what a compression stocking is.
Absolutely, thank you. A compression stocking is knit in a way that the greatest compression is at the ankle and the compression slightly reduces as it goes up the leg to always create an upward flow of the blood and the fluid, which is so important not only for elderly people, but for active young people, people flying, athletes. This is something that will give you energy and really feel good. So it is not just for the elderly anymore. It is for everybody. Whether you're sitting at a desk or you're standing in one place all day at work, various needs.
Yeah, and you mentioned flying. I think a lot of people who are familiar with the benefits, as you mentioned, keeping that circulation going,
Right.
wear them sort of as a habit when they fly because they know that it's good for them. So what about people with diabetes, Kate? Why is it so important for them to wear compression stockings? And do you recommend that they wear them daily?
Absolutely. Compression hosiery is designed to wear during all your waking hours. No need to wear it to bed necessarily unless a doctor would advise otherwise. But the stockings are meant to, again, create that upward pressure and push to the fluid. Very often with diabetics, they get what's called edema, swelling of the foot, ankle, lower extremity. And that's why it's imperative for so many people to wear these stockings during all their waking hours to prevent that pooling of blood and fluid, which in turn can cause ulcers, like Samantha had mentioned.
Yeah, and then there's so many things that you have to consider then, which are not great to think about. Kate, what about the process of getting footed for these products?
Good question. We believe strongly in measuring the patient and customizing the fit so we know that they're in the proper size. So every individual that we take care of, if they haven't already worn hosiery and have been properly fitted, we recommend strongly for them to come in. We take measurements. I go over donning, which is putting on the stocking, as well as doffing, which is taking off, and care and usage of the stocking. So they get fully educated in regards to how to use the stockings and, more importantly, why they need to wear them.
It's so great that it includes all of that. What about insurance, Samantha? Do you bill insurance?
Yes, we do. So we bill almost all commercial plans, Medicare and Medicaid. And the only things, and just to say, that are not covered by insurance are like Medicare does not cover compression stocking. So that is a self-pay item for Medicare patients.
Are compression stockings generally quite affordable?
I would say for the most part they are. They can be a little pricey, all depending on what the patient needs, like how high the compression is, or if they're custom stockings, then you can get into more of a pricier range.
Do doctors, Kate, usually make a recommendation about the amount of pressure in a compression stocking for people who have diabetes?
Yes, most often a 20 to 30 millimeter of compression is the prescribed compression. Sometimes lower if someone is higher in age, whereas a younger person can tolerate a much higher compression. The doctor will very often put it on the prescription, but if they don't, I can definitely make that decision just in regards to what diagnosis we're dealing with.
Wonderful. Ladies, thank you so much for joining us. Really great information and education about all of these great products. We appreciate your time.
Thank you for
Thank you
yours.
very much.
Absolutely. And there's a great sale I want to share with people. So Xceed Medical's biannual compression stocking and diabetic shoes springtime sale is going on the entire month of April. You can get 25% off diabetic shoes and treat yourself to additional styles beyond what your insurance covers. Also, you can save up to 25% on ready-made stockings and 15% off custom-made stockings. You can call Xceed Medical at 414-235-8552 or visit them online at xceedmedical.com.